Good afternoon, Senator Tillis. My name is Tim Nichols. I am one of your constituents from Greensboro. Currently, I am the Oncology Service Line Clinical Nurse Educator at Cone Health. I've been a registered nurse for 22 years. I have experience in the emergency room. I have experience in oncology and also in administration. I'm here today to speak to you about a very important piece of legislation, the Lymphedema Treatment Act. This bill recently passed the House on November 17th and currently has 356 co-sponsors. In case you do not already know, lymphedema is a chronic condition that affects millions of patients. Most of those patients undergoing cancer treatments that can damage the lymph system and also the immune system. It causes significant arm and leg swelling. It can be so significant that it can actually render the limbs useless. In the absence of much needed lymphedema treatment, including compression garments, patients can experience some pretty awful outcomes. This is a particularly sensitive topic for me, as one of my beloved patients had to have her arm amputated because her lymphedema was so severe. Following the amputation, she continued to have swelling in her chest and recurrent infections. Unfortunately, these complications prematurely ended her life. If the patient had been able to receive the appropriate lymphedema treatment, including the compression devices, the outcome would have most likely been much different. In our current state, Medicare does not cover the cost of compression supplies, impacting almost 2 million beneficiaries. Currently, the Department of Veterans Affairs and the TRICARE program they do provide coverage for these devices. In addition to that, 42 states and the District of Columbia do have provisions in their Medicaid programs for these compression devices. This bill would require Medicare to cover the lymphedema compression treatment options under their durable medical equipment benefit. Some of the items that would be included would be standard fit and custom fit garments, also bandaging supplies that are always needed, and also other aids that may be ordered by a licensed provider. I'm here today on behalf of a very vulnerable patient population, a patient population that doesn't need any additional worries to consider. I'm here to garner your support for this extremely important piece of legislation that will definitely have a positive impact on many of your constituents and will also have an impact on many citizens across our amazing country. Can your people count on your endorsement of the Lymphedema Treatment Act? Thank you.